name is Dr. Ryan Miyamoto. I'm a sports and shoulder surgeon with Center Orthopaedics here in Fairfax, Virginia. Reverse shoulder replacement is typically indicated when a patient has both evidence of arthritis on plain x-ray or advanced imaging studies, secondarily in conjunction with rotator cuff damage. So the combination of the two we call rotator cuff arthropathy, and that's our most common indication for reverse shoulder replacement. The other less common indications include someone who's got a very bad fracture of the proximal humerus or a fracture of the shoulder that doesn't seem to be healing. These are less commonly indicated, but certainly sound indications for a reverse shoulder replacement as well. We utilize total shoulder replacement and reverse shoulder replacement for two different pathologies. Total shoulder arthroplasty is indicated when someone has bad evidence of osteoarthritis in the glenohumeral joint with an intact rotator cuff and with good bone stock. If those qualifications are met, then a patient's an excellent candidate for a total shoulder replacement. On the other hand, a reverse shoulder replacement is utilized when someone has, again, that same bad bone-on-bone arthritis, but when the rotator cuff is deficient, when the rotator cuff is torn, or when there's insufficient bone stock to safely and securely mount a regular shoulder replacement. These are, again, the most common indications for a reverse shoulder replacement. Our hope is between 15 to 25 years. Some of the data is still out there in terms of longevity of the implant, but similar to either a knee replacement or a hip replacement, typically the poly, which is the plastic piece in a shoulder replacement, is what we're often evaluating when patients come back with persistent shoulder pain or increased shoulder pain after a shoulder replacement. Well, full recovery, we say, can last up to 9 months. However, early recovery includes a sling for about 3 weeks. Frequently, even at the 6-week mark, people notice a marked improvement in pain relief, as well as a marked improvement in function. Formal therapy typically lasts through about the 3-month mark, but some patients will notice incremental gains both in function, range of motion, and strength, even up through the 9-month mark. With the modern implants that we use for reverse shoulder replacement, there's almost no limitation after surgery. The biggest ones that we still tend to caution patients about are heavy, quick, violent overhead motions, such as lifting super heavy weights in a singular violent motion. But otherwise, these days, we let our reverse shoulder replacement patients work out, play golf, go skiing. Certainly day-to-day functions around the house have almost no limitations. And that really has to do with the advent of stronger implants and more stable implants, even than 5 or 10 years ago. Fortunately, these days, I would say approximately 85 to 90% of shoulder replacements go home the same day. The procedure itself takes about an hour and 15 minutes. And after a brief stay in the recovery room, about 85 to 90% of patients go home. Certainly, if there's any issues with blood pressure or pain, patients may stay up to 1 night in the hospital. But again, the heavy majority are able to go home the same day.